I mean, I guess in the context of an insurance approach, becomes even more important, if that could be the case, to really understand what works. If we're making upfront investments, if we're trying to think about costs across a lifetime, and our key objectives are to deliver outcomes for our participants in terms of social and economic participation, and economic returns to broader sort of Australian society, then it becomes incumbent on us to really have a good understanding of what sorts of things work best. And there's a research angle on that, clearly, and we're doing work now to understand relative efficacy of different interventions that could be taken, whether that's the sorts of things that will help people with a psychosocial disability into employment, whether it be the sorts of things that are most likely to impact positively on people with intellectual disability in terms of their social and community participation. It's a wildly under-researched area, I think, if you compare it to things like the health system, where there's been really a lot more funding, a lot broader and sort of longer-term research into medical interventions. So disability is of course very different, but I think there's a lot we can do to get a lot smarter in how we understand what works. The other angle on that, in terms of participant choices, clearly the scheme, one of its insurance principles, goes to the importance of choice in terms of people being able to choose the sorts of supports that will work for them and their lives, with the creativity and innovation that can come from that, rather than being restricted perhaps to more traditional service provision. And the task for us really as an agency is to try and ensure that our participants in making those choices are doing so as far as possible as informed consumers. And there's a real implication from that in terms of how research is structured and the sorts of questions that you ask, but probably more importantly, the focus that really needs to be there on research translation, or really how you're putting that evidence in ways that will work into the hands of participants at the right point within their journey with the scheme, so that it can help them to understand the sorts of things that other people have tried that may have worked in similar circumstances, what the evidence tells you about a certain intervention, and what you might need to consider for your child on the autism spectrum, for example, or whatever it might be. And that's actually even more important now than it has ever been, because of additional flexibilities that we're introducing through some quite fundamental reforms to the scheme at the moment, which will increase the ability of participants to use funding in their plan more flexibly and over a longer duration. So much of the focus of research is on those two things. It's on what works best. What does the research tell us about that? How can we chunk that up in such a way that we can start to understand that perhaps better from a relatively low base? And then secondly, how do we actually put that evidence into people's hands in a way that's going to be most effective for them to make really good and informed decisions as they go? And of course, the research is only one part of that. There's a much broader set of resources that need to come into play to enable people to make good and informed decisions about how they implement their plan. And that can come from our own data and what that tells us about what people are trying and what's working in different circumstances. And as I referred to in the last question, it's a really phenomenal sort of data set that we have to work with now over the 8 years that the scheme's been running. And then there'll also be the perspective of experts coming to play, which is another part of my kind of responsibilities with the agency, in giving a view on what constitutes really good early intervention supports for children with developmental delay, for example. So all of that needs to come together really to help our participants to be good and informed consumers, and to help the scheme to make really good evidence-informed policy and strategic decisions as we progress.